Self-managed abortion using pills is a process where a person ends a pregnancy using specific medications without undergoing a surgical procedure. Often chosen for its privacy and convenience, this method is typically done at home and can feel more natural and less invasive compared to clinical procedures. Many individuals find it empowering to manage the process themselves, and for some, it can resemble the experience of a spontaneous miscarriage. This type of abortion involves the use of medication, and the most common approach includes two different drugs, mifepristone and misoprostol. Mifepristone works by blocking a hormone called progesterone, which is necessary to maintain pregnancy. It also helps to soften the cervix, which is the lower part of the uterus. After taking mifepristone, the second medication, misoprostol, is used. Misoprostol causes the uterus to contract, helping to expel the pregnancy tissue. When used together, these medications are highly effective and work in a way that mimics the body's natural process during a miscarriage. In situations where mifepristone is not available, misoprostol can be used alone. This method can still be effective, although it may require additional doses, and the likelihood of completing the abortion without further intervention is somewhat lower compared to the combined method. The usual experience includes cramping and bleeding, which are signs that the medications are working as expected. Accessing abortion pills can be done through a variety of channels, depending on where someone lives. This might involve visiting a healthcare provider, such as a doctor or midwife, or obtaining guidance and medication from a clinic. In some regions, there are also online resources and services that offer support. It is important to ensure that any medication used is obtained from a reliable source and that the instructions are followed carefully. When used correctly, abortion pills are known to be highly effective for ending a pregnancy in its early stages. Regarding safety, research shows that self-managed abortion with pills has a strong track record. Complications are uncommon, and many individuals are able to complete the process without needing additional medical attention. However, there are circumstances where professional care may be necessary. For instance, if someone experiences signs of infection, such as fever or foul-smelling discharge, or if there is very heavy bleeding or severe pain that is not eased by medication, it is essential to seek medical help. Most people who are in the early stages of pregnancy can safely use abortion pills. This includes younger and older individuals, those who have children, and those who do not. People who have previously had abortions or cesarean deliveries are generally also eligible. Age and body weight do not typically affect how well the medications work, and the dosage remains consistent across these variations. Individuals who are breastfeeding can also usually use the pills, though they may wish to discuss this with a healthcare provider. While medication abortion is suitable for many, there are rare instances when it is not recommended. One important condition to be aware of is ectopic pregnancy, which occurs when a fertilized egg implants outside the uterus. In such cases, abortion pills are not effective, and immediate medical treatment is needed. Other rare contraindications include certain genetic disorders, like porphyria, or medical issues related to the adrenal glands. It is important to disclose any known health conditions to a medical professional if possible. Additionally, if someone is using an intrauterine device, it should typically be removed before taking abortion pills. Legal access to abortion pills varies depending on local laws and regulations. Some regions have clear guidelines that support self-managed abortion, while others may have restrictions. It is vital to be informed about the legal context in your specific area. Reliable organizations and health professionals can offer up-to-date information to help individuals understand their rights and options. During a medication abortion, the process generally starts with taking mifepristone, followed by misoprostol after a specified time. The effects of misoprostol often begin within a few hours, leading to cramping and bleeding. Pain can usually be managed with over-the-counter pain relief, and using heat or relaxation techniques may also help. Passing the pregnancy tissue is a key part of the process, and bleeding can continue for several days. In some cases, a follow-up with a healthcare provider may be helpful to confirm that the abortion is complete. Emotional responses to the experience can vary, and supportive resources are available for anyone who may need them. There are many myths and misconceptions about abortion pills. One common misunderstanding is confusing them with emergency contraception, which works differently and is used to prevent pregnancy, not end it. Scientific research continues to support the safety and effectiveness of abortion with pills when used appropriately, and dispelling misinformation is crucial to making informed choices. For those considering a self-managed abortion, various organizations offer accurate information and emotional support. Helplines and reputable websites can provide guidance on the process and help ensure that individuals have access to safe, reliable options. In conclusion, a self-managed abortion with pills is a well-established method that allows many people to take control of their reproductive health in a private and informed way. While it is a safe and effective option for most, it is essential to approach it with proper knowledge and support. This content is intended to provide general information and should not replace professional medical advice. Always consult a qualified healthcare provider before making any decisions related to abortion or reproductive health.